Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio today is Dr. George Tetz. He's the Chief Science Officer of the Human Microbiology Institute. It's an independent, not-for-profit scientific research organization that's addressing some of society's biggest medical challenges. And he's here today to talk with us about some data from his presentation at the American Society for Microbiology about a spore-forming bacteria that seems to pose a significant challenge to human health. Welcome to Health Professional Radio, Dr. Tetz.
Thank you very much.
Glad that you could join us today. Now, I'm sure you weren't always the Chief Science Officer for the Human Microbiology Institute. Give our listeners a bit about your background.
Sure, absolutely. I'm an MD, PhD in medical microbiology, dealing with the microbiological research for the last 17 years. And I have also the same time for the drug development experience, dealing with the development of novel antimicrobial and anti-cancer drug candidates.
You were doing a presentation with the American Society for Microbiology, Microbe 2017. You gave a couple of presentations there. We'll talk about the first one, this spore-forming bacteria. Is this a newly discovered bacteria, or is this research that is giving us more information about bacteria that we knew about previously?
Well, actually, our group and our core, we were first outlined a new group of bacteria that principally differs from the other microorganisms. These bacteria, some of them are well known, some of them are not yet discovered. However, we have identified a group of spore-forming bacteria as an independent element within a global microbiota.
And that element would be how it's significant?
Sure. Actually, we outlined this new group of bacteria that principally differs from other microorganisms and other bacteria. And this group, it has an individual implications to other organisms and human health. So actually, let me just brief you that there is a number of spore-forming bacteria that are characterized by the formation of spores. In other words, so this unique feature is not attributed to all microorganisms. And the main purpose for the spore formation is to preserve bacterial viability, because spores are highly resistant to the environmental challenges, including antibiotics, immune response, heating, drying, and spores preserve bacterial viability under the lethal environment that kills vegetative bacteria. There is a number of spore-forming microorganisms, as I mentioned. So some of them are well known, including the most prominent and best performers as the members of Sporobiota is a Clostridium difficile. That is, of course, a headliner of all the scientific journals, and they will soon become a villain of a very scary tales for children. So there is a number of different spore-forming bacteria. However, our core, we first outlined the necessity for describing them separately because they have a principal independent implications for human health and spread of antibiotic resistance. And in addition, our core identified over 140 previously unknown performers from different parts of the human body. Of course, this group is very poorly studied, and we identified that these microorganisms possess particular influence in the spreading of antibiotic resistance and are associated with the different human pathologies.
How quickly do these spores attack the human body? Do they attack the gut health and thereby affecting the rest of the body, or do they attack specific organs or other microbes in the body?
Well, we have identified over 140 previously unknown members of Sporobiota and spore-forming bacteria that from different parts of the human body, and we evaluated their possible implications in a variety of human infectious pathologies, including urinary tract infections, including infections of lungs, in particular in immunocompromised patients, and a variety of inflammatory and malignancy conditions of our gut. So spores, they're highly resistant. And actually another issue, and why we proposed the evaluating and its performance as an independent element novel is that spores, they are highly resistant to the outer environment, and therefore they possess high transmission potential. And this high transmission potential, well, it is the hallmark of all these microorganisms. Therefore, the highly resistant endospermers performers, they transfer and disseminate through host to host, including patient-to-patient transmission. And another issue is that people are acquiring spores from the outer environment, because spores can survive in the outer environment for for a very long period of time, as they're particularly are not affected by the environmental challenges.
How effective are some of the treatments that we have currently for these newly identified spores? And are these treatments being updated regularly as new spores are being discovered in different research?
This is a great issue for today's medicine. So the infections caused by members of Sporobiota, they share similar characteristics, including chronicity, persistence, relapses, leading to similar therapeutic challenges. Antibiotics and the immune system effectively affects vegetative cells. However, bacterial spores that are not affected by the environmental challenges and antibiotics, they allow bacterial regrowth, leading to the chronicity of pathological processes and to the relapses. For example, one of the most, as I mentioned, well-known member of Sporobiota in the healthcare setting is the Clostridium difficile and the C. diff infections. They're very poorly treated with antibiotics. And for today's medicine, actually, one of the only options for these patients who suffer from these infections for many, many years is only the fecal transplantation. In other words, it is a replacement of personal microbiota to the outer microbiota obtained from the donor. Therefore, the existing medicines, they're very poorly, they have very low efficacy against infections caused by Sporobiota members.
So that's pretty scary. Is there anything that we can do as far as, other than what you say, the replacement of the matter from the donor, as far as diet or any type of hygienic things that we're able to do? I mean, if they can resist these drugs, obviously they're going to resist the normal things that we do to keep ourselves clean.
I don't want to scare you, but it is also an issue, because as I mentioned, spores are highly resistant to the physical, different chemical and physical agents. Mm-hmm. And spores are resilient to the traditional sanitizers. So actually, if you look to the PubMed for the last 5 or 10 years, the number of issues and the number of clinical cases caused by the members of Sporobiota, it dramatically increases. And I will tell you why, because actually this issue also belongs to the high transmission potential of the spores from the outer environment and vice versa. Because, look, spores are resistant to the environmental conditions. But patients and, humans constantly exposed to them, and we obtain spores from the outer environment. As far as urbanization grows, people also disseminate spores from their cells, leading to the accumulation of these spores in the outer environment and in the cities. So we have performed also analysis. Actually, it was not the part of this research, but it was done before. Right now, this article is under publication. But we have we just took a look for the number of spores on the handles of the buildings and on the handles of the shopping carts in New York. And there was a dramatic amount of variety of spores and we performed a variety of microbiological and genomic methods and evaluated a great number of virulence factors and antibiotic-resistant genes that were found over there.
Where can our listeners go and get more information about the Human Microbiology Institute and some more about your presentation on Sporobiota?
Human Microbiology Institute, it's a non-for-profit scientific research organization that was established in New York in 2015, and our primary goal is the study of human microbiota and actually the environmental bacteria and microbiota globally, and how do it affect the humans and how humans affect the global microbiota. And our goal, of course, is finding ways for the treatment of currently poorly treated pathologies, including those caused by a variety of bacteria, and we also study the interplay of human microbiota with humans. So we have a lot on our plate.
Well, I appreciate you coming today and speaking with us about this subject, hoping that you'll come back and speak with us again on some different topics.
Sure. Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. George Tetz, the Chief Science Officer of the Human Microbiology Institute. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm.